Hi, I'm Dr. Jason Wagner with Sarasota Vascular Specialists, and thank you for joining me for another Whiteboard Wednesday. Today, we're going to talk about the important relationship between a vascular surgeon and their patient when it comes to dialysis access creation and management. This is a lifelong, long-standing, back and forth, good communicating relationship between the vascular surgeon, the patient, the vascular surgeon in the dialysis unit and the vascular surgeon and the patient. It's very important to have communication be key because we need to know when things are working well for the patient, when they're working well for the dialysis unit or the dialysis providers, and what we need to do and respond to it quickly if there are any issues. So the first step in the relationship is really the first evaluation and the creation of the access. Do you want to do peritoneal dialysis, where that's something you can do at home at night and you not have to go to a dialysis unit? Or do you want to do in-center hemodialysis, where you're going to the dialysis unit a couple times a week and being hooked up to machines that way? Figuring out what the patient is suitable for, be it lifestyle factors, overall health factors, and things like that is important. And that's going to be a good long communication between the surgeon and the patient to figure out what their wishes are and also what their overall functional status and suitability is going to be. Because I don't want to create an access if it's going to be working perfectly but could never be used correctly in the right setting. That's the evaluation. Then we talk about the creation. So that's going to be, figuring out what we're going to do. So if it's going to be a fistula or a graft, we're going to get ultrasounds. We're going to figure out what the veins and the arteries look like, and we're going to plan to create a fistula or graft in the arm. The next steps, going to the operating room, creating the access, establishing a way of having hemodialysis be provided at the dialysis unit or at home, or if it's peritoneal dialysis, getting the catheter in the belly in the operating room. After that, we're going to keep following up with you. It's not, okay, great, you're healed up, see you later. It's going to be a long-term, lifelong follow-up for that access and for that patient. So for a fistula or a graft, what we're going to do is we're going to create the access. We're going to see you back in a couple of weeks, check the incision, make sure things are healing up appropriately. Then after that, we're going to get an ultrasound and make sure there's enough flow going through the vein or through the graft that it's suitable for dialysis use. We're going to then give you a form that says, okay, this thing's ready to go, ready to use dialysis. So then your dialysis unit's going to start using it for dialysis. And then if you have a tunneled catheter in the chest as your temporary or bridge means of access, I'm going to take that out. That takes about 3 to 5 minutes in clinic, pretty painless. Come and go same day, not a big deal. You get to start showering again a couple of days after that. Then it's going to be about monitoring, about follow-up. So for a hemodialysis access, the way we're going to do this is obviously with an ultrasound, checking the flow in the graft or in the fistula, making sure that there aren't any new narrowings or blockages or problems, making sure that it's not taking too much blood flow away from the hand and that everything's looking okay. That's from the objective or kind of the technical side. Also, we need to make sure that the dialysis unit nurses and technicians are using it without a problem, because I could build the most beautiful fistula or the most beautiful graft, but if the dialysis nurses are having a problem using it, then it doesn't matter how good it looks if it can't be used correctly. So we got to make sure that's working well for the patient and for the dialysis unit. We also need to make sure that it's not having a prolonged bleeding or any other problems that might be signs of early or impending failure. And if we start finding a problem, be it a narrowing in the outflow, we want to repair it or treat it proactively. We don't want to just let it clot off and then plan for a new access as a one and done. No different than if you have a new car and you're driving it for a while and your tires start to wear out, you're not just going to, trade in your car for a new car or just throw away the car, park it and never drive it again. You're going to get new tires, or you're going to change your belts or change your oil, do different things. There are different maintenance procedures we can do to help extend the life and functionality of a dialysis graft, fistula, or even a peritoneal catheter. If we get to the point where we're having to repair it or be worried about long-term viability of that access, we need to start planning for the next access. So if you have a fistula down at the wrist and it's starting to have problems, we're going to start looking at higher in the arm to create a new access. And oftentimes what we can do, take care of the old one, reconnect the new, or connect up the new one, get you up and running pretty much right away, or have you have a tunneled catheter for as short a period of time as possible. But that relationship between the vascular surgeon and the patient, it's not just, okay, I'm going to tell you what we're going to do. I need you to tell me what works for you. I need to know, okay, yeah, like I really don't want to use this arm for this reason, or I know I'm right-handed, but I really want to use my right arm because of whatever reason. It's a good communication because I want to make sure, and all the vascular surgeons want to make sure that whatever access we're creating or whatever we're doing to help you prolong your life and help replace your renal function with a dialysis graft, fistula, or peritoneal catheter, I need to make sure that it works for you, not just from a functional perspective, but from a social and overall use perspective. The relationship between a vascular surgeon and their patient isn't just, you come, you get a procedure, and you're done, and I'll see if you have a problem. It's about surveillance, about maintenance, about future planning. I'm Jason Wagner, Sarasota Vascular Specialists, and thanks for joining me for a Whiteboard Wednesday on dialysis access. Thank you.